I'm Jean-Philippe Langevin, and I am the Director of Restorative Neurosurgery at the Pacific Neuroscience Institute. My expertise is to treat neurological and psychiatric disorders such as Parkinson's disease, essential tremor, dystonia, and obsessive compulsive disorder. If you feel like the medication is not quite enough to help you out and get you through the day in terms of your activity of daily living, your hobbies, or your job, to the point where you're thinking about stopping those activities, that's when you should consider DBS. So the way we do DBS surgery at Pacific Neuroscience Institute is that we use a frameless system that allows us to do the surgery with the same precision as a frame-based system without having to lock in the head of the patient and immobilize them during the surgery. What it means for the patient is that we've broken down the surgery into 3 steps. The first step is done in the clinic environment where the patient comes into our offices, and then we place 4 tiny markers on the skull. And so that procedure is done under numbing medication or local anesthesia. And we place 4 markers, and then the skin is closed on top of the markers so that you don't see anything from the outside. So that step basically sets the stage for what's to come or the next surgery. So those markers are acting as a reference and as an anchor for that frameless custom-made device. So while you're at home waiting for the surgery, we actually are planning the entire procedure. So we have all the scans, the MRI and the CT scans of the patient's head with the markers as a reference. And then we plan exactly where we want the electrode to go, from where they start, where they end. And essentially a custom-made mini frame gets 3D printed. And that frame has 4 legs. Where each leg is going to be attached to one of the anchor that we place on the skull. And so on the day of the surgery, the main surgery, then the patient comes into the operating room. The anesthesiologist basically gives them the medication so that you're asleep and comfortable. And then we reopen the 4 spots to expose the markers, and then we attach that custom-made piece, and it gets anchored onto the 4 pieces. And so the important thing here is that the precision is preserved in that once it's bolted in place, it guides the 2 electrodes directly on the intended trajectory on the target. However, the patient head is not immobilized. And so that is important because during the surgery, once the electrodes are in place, we want the patient to emerge from anesthesia for a brief period of time, so that we can test out the electrode and make sure that they're in the right spot, that we're going to be able to use the electrical current without causing any side effects. And so during that time, it's nice to have the patient comfortable, that they don't have any neck pain when they're awake. Otherwise, the anesthesiologist will have to give more medication that can cloud their experience and cloud how they feel, basically, or telling us how they feel with the examination. So that's for the main surgery. That step takes approximately 4 to 5 hours just to make sure that the electrodes are in the right spot and that they are anchored properly. And then once we're happy, all the electrodes are tunneled and inserted under the scalp, so there's nothing visible on the outside. And the 4 markers are removed at that time as well. And the patient gets admitted to the hospital. And the reason for the admission is twofold: to make sure that they're doing well. We obtain additional scan to confirm that the electrodes are right on track, right on spot. And the other thing is we want to make sure that the pain is well controlled and the patients are able to get up around, return to their normal activity. So that's for the main surgery. And then a week later, the patient returns to have the placement of the pulse generator. So that's basically the tiny computer that will send the electrical pulse to the electrode. And so that gets inserted under the collarbone, typically on the right side. And there's a connecting wire that attaches from the electrode to the pulse generator. And so that step is an outpatient procedure, meaning that you come into the hospital to get your procedure done, you go home the same day. It's done under a general anesthesia, so it's a really comfortable procedure, and as well as it's low risk, because this time it's not inside the skull or on the brain. The one question that patients oftentimes ask me is, any of those connecting wires or generator or electrodes visible from the outside? And so the answer is that no. So all the components are hidden under the skin. So there's nothing visible outside the patient. Our greatest reward is to see the improvement that we make on patient. In other surgical procedures that we do, we see an immediate effect or an effect, on strength or things like that. With DBS, I feel like it's almost more personal in a way, because not only are we affecting the function of the patient, but directly their quality of life.